to Volunteer 207. My name is Maryalice Crofton. I'm Executive Director for Volunteer Maine, which is the State Service Commission. And my co-host for this series is
Kelsey Priest. I'm the Program Officer of Volunteer Initiatives.
And today we are bringing you the first of the series, and it is going to focus on issues that volunteer managers and leaders of volunteer programming can use. Today our theme is about mental health and mental health programs and training that volunteers who are not focused in mental health programs can bring out into the community. And maybe you could introduce, Kelsey, our first guest.
Sure. So we have Cindy Whitney, who has over 30 years of volunteer management experience. And recently she trained her volunteers in mental health first aid. So she's here to explain what mental health first aid is and how others can use it.
Good day, everybody. And I have the pleasure of talking with Cindy Whitney today. And she, as you can see on her screen, is a certified volunteer administrator. And Cindy, I'm going to let you introduce yourself a little bit, starting with your National Guard experience through all the volunteer places you've been. And then we'll talk a little bit about the mental health first aid program.
Sure. Hi, everybody. I'm a 31-year veteran of volunteer management. I started my volunteer management career with the Air National Guard here in the state of Maine. And prior to some more official positions, I was a full-time volunteer running the Family Services Program for the Air National Guard. Did that through Desert Storm and some other crises in the world for 10 years. And then moved on to national service, where I became a director of an RSVP, retired and senior volunteer program, one of the national service programs, and then worked my way through several positions at various agencies through the three programs of AmeriCorps Seniors, RSVP, Foster Grandparent Program, and Senior Companion.
And now you're semi-retired or taking a break, however, so we are pleased to have you back with that full scope of experience. And let's start with what is mental health first aid, and then I'm going to focus in on kind of what you did with volunteers around that.
Sure. Well, mental health first aid is a program sort of aligned the same way you would go and take a regular first aid program and you would learn CPR and things like that, only on the mental health side. So it trains people in a variety of settings without any professional experience to step in to recognize signs of a developing mental health crisis and to appropriately respond and to move that crisis forward to professional help. They use a method called ALGEE, ALGEE. It stands for assessing the risk is the first letter, listening non-judgmentally, giving reassurance, and then the two E's both stand for encourage. One is encouraging professional help. The second is encouraging self-help and other supports around them. So it gives a framework for the folks who are trained, any community members, to work within. It also, very importantly, tells people how not to respond. And we all, as human beings, no matter with our friends, family, and everybody else, have at many times in our lives said the absolute wrong thing at the absolute wrong time. And this training actually gives people that right up front. It shows you what happens. They have several videos that people work through in the training. It shows you what happens if you take the wrong track in working with somebody who's in a crisis, which is a very, very important part of it. They go through many types of mental health issues, from depression, anxiety, substance use disorder, and all the way up to psychosis. So depending on what a person may be experiencing, as a first aider, you're trained on what type of things you might see and how appropriate and non-appropriate ways to respond to that, to sort of like you would stop the bleeding with regular first aid, to sort of minimize the situation and get it to a level that the other responses can step in.
And this isn't the only thing that the volunteers do. It's sort of an additional training for people who might be doing other things, right? And all age groups.
Absolutely. They have what they call modules, and they range, there's an adult module, a youth module, teen module, first responders, veterans, older adults, and there's actually one is specialized fire and EMS. So there are really several different modules that they use that fine tune what a certain segments of the population, both as first aiders may experience in their, in their lives and in their work. And then also the type of sort of prevalent issues that they may see in the population that they're around. And most first aiders will tell you that it did help them in their work or their volunteer work or their workaday lives, whether they be school staff or whatever. But it also gave them a great deal in their personal lives, because we don't just experience these things with those we work with, whether we're volunteers or this is part of a paid position. We experience these in our personal lives. And, people have felt that value over and over again.
So to bring it kind of down to Maine, and where did you have the opportunity to introduce this to your volunteers? What were they doing?
Right. Well, I was the director of a senior companion program at the house at the Center on Aging of the University of Maine. And for those who don't know, senior companions are older adult volunteers who go into the homes of other older adults in the community who are isolated and lonely, and make that connection. Isolation is one of the highest risk factors for older adults and their longevity. So these are people that go in several times a week and visit with other older adults. And what we did was we were able to get an implementation grant, and we brought in mental health first aid training for all of our older adult volunteers. We actually partnered that with some other experts in the state of Maine and added through our older adult module a spin on the substance use disorder part of the training and the opioid epidemic in Maine. We really felt that with older adults in New England and Maine especially, that there was a lot of anxiety and depression that was unrecognized and untreated. And we wanted to see if we could have an impact on recognizing that and bringing in a trusted person to help those folks find and access professional support. But we also wanted to help people get more information and more professional support around pain management and opioids. We felt that the senior population had a lot of the prescription opioids in the state, and that there might be some movement of the opioid drugs that way within our state. And there also might be some misuse. I remember a training that I attended with Public Health Office in Bangor, speaking about what an overdose looked like, and the confusion that happens with an overdose and the slowed breathing. I thought to myself, how many seniors do we have in our state who are overdosing, going to an emergency room, and if those are their symptoms, there's no toxicology and there's no recognition that that's that, and then they just lose their lives. It may have been an overdose and not just a heart issue or some other problem that, because you're 70 or 80 years old, people will assume. So, we just felt that that was out there. We wanted to take this. The training is a very intensive training. It takes a lot of time, and it's quite frankly tough issues for people to talk about. But it's done very openly and very forthrightly. And our volunteers, I thought at first might be, oh my Lord, I don't want to sit this long listening to this topic. And
Right.
what I found was the exact opposite. They loved it. They felt it was one of the most meaningful things they had done in their volunteer work. And one after another, they saw the value of taking this into the homes of the people that they were working with.
And they covered more than the Bangor area, right?
Yes, absolutely. Our program covered 10 of the 16 counties in Maine. So yeah, most of the interior of Maine.
So it was something that they could bring to a wide spectrum of folks, not just around where there were services, but some of the rural areas for sure.
Absolutely. We were primarily rural, and surprisingly, I mean, I think people tend to think that in terms of isolation and loneliness in our older adult population, that that's a bigger issue in the rural areas. But some of the most isolated people I saw were in urban settings. It has no boundaries, and but yeah, the support systems when you get out rurally, that's where you have the bigger challenge. There are, more availability and transportation being what it is in our state, more access in the urban areas than it is in the rural areas. So that was something that we really developed a listing and a toolkit, more or less, that our volunteers use so that they could find close to and accessible for the folks that they were working with, whether it be support groups and other professional entities and telehealth methods and so forth around the state.
So some folks might listen to this and say, well, there must have been special criteria for the volunteers in order to be able to take mental health first aid. What were the qualifications for your volunteers? Were they?
Yeah, absolutely not. There are absolutely none. This is a program, same as first aid, where, it's hoped that in a crisis, as many people around you as possible know first aid. The same thing goes for mental health first aid. This is a course that is for the general public, no matter what they do. If you're the person when a crisis happens who happens to be nearby and the only one who can respond, if I'm the person in the crisis, I certainly hope you've had some sort of training.
Sure.
Whether it's a mental health crisis or a physical crisis. So this training is meant to get out to as much of the public in every sort of setting. The modules are just designed for certain parts. So if say your school staff would take a youth or teen module, there's an overall training, and then the modules kind of fine-tuned down to a certain segment of the population, which is why our module was the older adult module. So we do the overall training on adult mental health first aid, and then it is partnered in with the older adult module because those are the population that we're in touch with. But no, in terms of criterion to be trained as a mental health first aider, as many people as possible, because there's nobody checks your training if you're the one who happens to be the crisis.
Right. And so is it hard to get this training provided to volunteers? I mean, are there many trainers in the state? Do you have to bring somebody in from out of state?
No, there's actually a process where a lot of people can be trained as trainers. Generally, those people sort of have some experience. That's where some criteria to be trained is in the trainers themselves. The trainer we at first used was a professor at the university who was a psychologist. And so she came in with a psychology degree and experience that way. But there are many licensed social workers and other people around the state who have been trained as trainers. They generally are trained on certain models, or others are trained across for the general training. I know NAMI Maine is one of the organizations that has mental health first aiders. And across New England, I know there are a number of trainers out of New Hampshire. That the mental health first aid website actually has an availability to find trainers. So organizations that wanted to do this and can look up and find available trainers to come and do the training for their groups.
You anticipated what I was going to ask you, which is, so it's the mental health first aid program has a website, and people can go there and search out trainers if they want to bring this into their program, that is volunteer drivers or volunteer folks in food pantries or any number of places where they might come across folks on a regular basis, and want to sort of have that, like they do, like you said, along with the first aid and CPR in their back pocket.
Yes, yeah,
Just know.
absolutely. And if an individual just wants to take a training, it isn't a group. An individual can go onto the website and actually find a training that is, as near as possible to them, or is a date that's available. The website is spelled out mentalhealthfirstaid.org. So it tells you more about mental health first aid as a program and the different modules. And I also want to say that it's not just something that's for adults. In many places, teens and other groups take these to support one another. Teen suicide. I mean, I think it was the 2020 to 2021. It was the beginning of the pandemic. Suicide rate in Maine for older adults had jumped 40% at the start of the pandemic. And of course, the youth suicide rate has always been way higher everywhere. And so this isn't something that is just for people that are 21 or older or something like that. But teens do this, older adults. It's like I say, it's like first aid for the body. This is something that we, as many people as possible, should take this. Once you take the one training, you're certified as a first aider for 3 years.
Cindy, thank you so much for sharing all this information with us. One of the things that we're trying to make folks think about and be aware of is that volunteers can add these dimensions to what they're doing, and also that volunteers are able to do things that, on the surface, somebody might say, oh no, you can only have a professional who's got that sort of training or whatever. But I appreciate the time that you spent with us and look forward to seeing you in the Volunteer Managers Network.
Thank you very much.
Have a great day.
Bye-bye.
Thank you to Cindy. That was great. Maryalice, you can introduce our next guest.
So our next guest is Fred Mead. He is one of the founders for the New England chapter of Disaster Chaplains. And those folks are actually part of the volunteer chaplain service, folks that show up with emergency responders during disasters, be they local fires or whatever. And he is one of the people who goes around the region training folks in volunteer mental health.
And I'm welcoming today Reverend Fred Mead, who is one of the founders of the New England chapter of Disaster Chaplains, and is here to talk to us about emotional resilience. But maybe first you could give us a little bit about yourself and how you got into this particular disaster chaplain work.
Okay, that'd be great. Thank you for this opportunity, first of all. I had been ordained for 20 years as a congregational pastor when I served at church in New Orleans, Louisiana. And then, of course, Katrina came during that time period. And I ended up personally in a shelter for 3 months. So even though I had been ordained for 20 years at that time, I really got another look at, because I'm kind of a people watcher person, about how trauma affects people. And after, when we all got back, when 3 months after being in the shelter, we were all allowed to come back and look at and try and get back into our homes if they were still there. I realized that I came back to a very broken community. All of New Orleans was broken back then. 80% of the houses were flooded. It was an unbelievable amount of destruction. And so I stayed there for 3 years before I decided to return to New England. And when I returned to New England, I learned not only that I had new knowledge about people, but also I had experienced some trauma myself, having been through that with the work that I did. I took a lot of courses related to suffering and trauma, meaning making, became a fire chaplain for quite a few years. And then I discovered that that there's a unique role for people who can do disaster chaplaincy in the Northeast. So I ended up volunteering for the Red Cross. And during my time with the Red Cross, I traveled all over the country as a disaster chaplain, going on major floods or hurricanes or other kinds of events. And then shortly after I did that, I started the program NEDCA, which can be found at nedca.org. That says a lot about who we are. And we developed several training programs for organizations literally around the country. We've taught for FEMA, we've taught for multiple VOADs. 2 nights ago, I was teaching a group of volunteers in Northern California who are blind and working with blind volunteers in their program, and they wanted to understand about trauma and resilience. A week ago, I was working with volunteers in the Philippines who are still in the process of recovering from Odette. So a lot of what I do, I mean, I don't know that there's any one specialty that you can take in school. It's really a compilation of a lot of different courses and work and experience that I've had. If you want to find out about our training, we have one coming up on April 20th. It's almost filled up. It's available for 80 people. I think we're at 78 or something. It's a free training. But if you go to nedca.org, nedca.org, you'll see a little bit about our organization. We just think, we thought that it was really important that emergency managers, and there's usually one in every community or county, that they should know immediately who would be available to do chaplaincy work. So we put together this program. It's been very successful in Massachusetts, and we're trying to move now into Rhode Island and Connecticut because we think it's important. And what I discovered is that in the midst of for example, a fire that's going on, the firefighters shouldn't be dealing with people. They should be fighting the fire. And so chaplains should be there to take care of the needs of people. And we have specialized training in that as well.
So could you start with maybe talking about what is emotional resilience and why it's important?
I'd be glad to. It's not, resilience is a little bit of a buzzword. Emotional resilience is kind of one of those things. Some people used to think it was our ability to bounce back from a difficult event, whether it's considered traumatic or not. I have another definition of resilience, and that is that not only do we bounce back, but we become better versions of who we are because of the suffering we've been through. And that's really important. One of the parts of one of the courses we teach is called post-traumatic growth, which is a series of how do we grow from horrible things that we've been to and have more meaning and purpose in life because of the event that we've been through. So in terms of contextually where we are in a culture, I imagine that there are very few people across our great nation of ours that haven't had some form of either political types of strife in their lives, cultural biases that are going on in our country, the results of traumatic experiences around COVID. Maybe people even have individual family issues because of that, people not being able to bury or see their loved ones before they died. So there's a whole lot going on in our culture right now. So as I think about teaching, which I've done emotional resilience, it's really not just for chaplains. It's for anyone who wants to have a deeper understanding of self and what are the next steps to become a better version of who you are.
So it's not something that somebody either has or hasn't. It's something that they can develop.
Well, I do think that some people are predisposed to being more compassionate than others. And some people have to learn that. They have to slow their monkey mind down and realize what gets in the way of them more clearly seeing the people in front of you. But it's a teachable skill. I mean, I've literally over the last 7 years taught hundreds of faith-based leaders across the country. in a wide variety of situations, whether they're Muslim or Jewish or Christian or Hindu or Catholic or Wiccan. One training I had, somebody was Wiccan, which was, I didn't know much about, but it was great having her on board. So it's really about a skill set to become, like I said, a better version of you. So.
You've talked a lot about chaplains who respond to disasters and emergencies, and certainly Maine has had, I'm not sure the condition or the strength of it now, but I know that there has been a network of chaplains who would be called upon by law enforcement for things. What community volunteer efforts do you think would benefit from focusing on emotional resilience outside of the chaplaincy work?
Well, as I was attempting to say earlier, I think anyone who is suffering in any way in their life needs to understand sort of what you can do about that. And it's not always jumping to a mental health provider. And I want to say publicly that not all licensed mental health providers are actually trauma informed. And that's something new I discovered in doing my work with first responders. Sometimes we would refer them to a licensed mental health provider, and the licensed mental health provider would say, whoa, that's too much gory stuff. I need to refer you to somebody else. But that's not their specialty. So when people need help, you need to make sure who you're speaking to. But not everybody needs a mental health provider. We know after major disasters across the country that 80% of Americans do fine without any kind of mental health support. I encourage organizations that are involved in disaster response to have peer-to-peer programs. So these are teachable skills. It's not just for chaplains. And that's why we talk about the importance of trauma-informed agencies, which I would hope would be one of the goals of volunteering in Maine, is for you as an organization to have a deeper understanding of, what is stress, what is trauma, and when we're in those kinds of situations, what can we do? Because all kind of people work can be incredibly stressful.
Right. So is there a role for this, for emotional resilience in those programs that have volunteers doing hospice work, or who are doing those sorts of, their ongoing giving with people who are under high stress?
Well, I can respond to that by quoting Charles Figley, and when he wrote about compassion fatigue, and that is compassion fatigue, which is the next step towards burnout, is it can happen to anybody. It's the price we pay for caring or for loving somebody else. So whether you're volunteering in the Red Cross, or volunteering in a hospice situation, or volunteering as an elder care person, you need to know your limits, and you need to be able to recognize when what you're doing is too much before you get burned out. Because what we teach is really about developing a better quality of life, which is really important. And it doesn't come from any particular, even though I'm an ordained pastor, been one for almost 40 years, we really don't talk a lot about religion, other than to say that when stress hits us, it does affect our sense of spirituality.
Right.
So it's important for people to understand that.
So this sounds as if your association, or you and your colleague, I'm not sure where the training unit comes from, but is unique to the New England area. Are there other folks, if somebody wanted to pull somebody in? Obviously, we'll direct them towards you, but as awareness grows, so might demand.
Absolutely, and it's been growing phenomenally recently. We've been doing a lot of training around the country. There are a lot of mental health centers that provide seminars, critical incident stress management out of Maryland provides ongoing courses, mostly for first responders, but often anybody can take those courses. You can Google psychological first aid and take what should be a 4-hour course there. It's about personal will and desire. It's how much do you want to learn? Because I've grown since Katrina in 2005. My growth has been exponential, partly because I was just really interested in the field, and partly because of what I've been through in life. I wanted to be able to deal with some of my own trauma in my life. So I had a personal investment as well as a professional investment in doing this. People can contact me if they have questions. My contact information is at nedca.org under contact. And so if an organization wants us to do a particular training focusing on something, we can talk about that. It's been good. I mean, it's been enjoyable helping people understand how to become better versions of themselves. Actually, it's really about serving the common good.
And it would seem to be really useful to have some folks who have this as a lens to approach things, because I know when there is, we don't tend to get tornadoes and that sort of thing. We get ice jams and towns flooded out and that sort of thing. But I'm fully aware that yes, yep, absolutely, all sorts of things like that. And I know FEMA's always saying the first 72 are on you, and that's also when people are really the most in shock.
Yeah, absolutely. And there's certain neurological reasons why. Actually, the federal government is saying to have enough supplies anywhere from 3 to 10 days, because it actually takes the government that long sometimes to be able to get in, do assessment, and get the Salvation Army or the Red Cross there to provide housing and food and shelter.
Right. Okay. Well, I want to thank you very much, sir, for taking time out of your day today to talk with us about this. And I hope you don't mind that you get a few minutes back in your day.
Thank you so much.
All right. Take care.
All right. Bye-bye.
Bye.
Thank you, Fred. So as a reminder, there are people here in Maine who can do a training on mental health first aid, and there are people who will also do a training on a train the trainer for mental health first aid. So if you're interested, get in contact with me, Kelsey. Maryalice, how about you tell us about our next episode?
So our next episode, we're going to reach out of state to a professor who published an article on how to differentiate a volunteer from an employee. And we will then follow that up with a surprise, one that we already know about, but we'll let you find out. And I would invite anybody watching who has an idea regarding a segment or a theme for an episode to be in touch with Kelsey as well. And we will go find some experts to interview. So thank you for joining us and have a great day.